Hi everyone, I'm Dr. Deborah Murray. We are going to talk about 10 tips to prevent your prosthetic joint infection. Thanks for joining me. We'll talk about your risk factors, the role of colonization and decolonization, and then stay tuned to the end where I'll give you the 10 infection prevention tips. Your risk of infection is dependent upon your own patient risk factors, as well as the hospital's attention to quality and evidence-based practices and the surgical technique in the operating room and maintaining that sterile technique. This talk focuses on the patient risk factors. So your risk factor, just having the prosthetic material increases your risk of infection. About 1 in 100 people get an infection that have a total hip or a total knee. Of course, this infection is going to depend upon the patient, the hospital, and the surgeon, and that includes whether or not you've had a prior infection at that site. Diabetes increases your risk of infection, especially if it's poorly controlled. Obesity has a significant increased risk of infection. Being immunocompromised, such as having chemotherapy or other immunocompromising medications, if you've had an organ transplant, or even steroid use. The most common infections are from the bacteria Staphylococcus. Now, Staphylococcus tends to live on the skin. You cannot sterilize the skin prior to implantation of the hardware. The surgeon, of course, tries to remove all of the bacteria on the skin, and the implants in the surgical field are sterile, but bacteria can gain its entry in the prosthesis regardless, either at the time of surgery or after surgery. Anything that can increase your risk of getting bacteria in the bloodstream can result in an infection on the hardware, and bacteria like to stick onto that hardware. They form what's called a biofilm. So this includes any cuts in your skin or poor daily oral care can increase your risk of infection. We discussed this in the past videos, how bacteria live with you. They live on your skin, they live in the nose, in the mouth, in the GI tract, and they can escape your immune system on occasion and end up in your bloodstream. If you have a few of them, sometimes your immune system can just take care of it on its own. There's a lot of variables here. Most infections are from the Staphylococcus bacteria, including Staph aureus. Now, Staph can live on the skin, especially in the nose or nostrils. We call it the nares, the exterior part of your nose. It can also live in other warm, moist places like your arms and under your arms and the groin. You cannot sterilize the skin. So about 1/3 of people are colonized with Staph aureus, and mostly with the sensitive Staph aureus strain called MSSA. Some people are colonized with MRSA, the methicillin-resistant Staph aureus. So since Staph aureus likes to live in the nostrils or the nares, this area is often tested to determine if it is present. And patients colonized with Staph aureus have a 2 to 14 times increased risk of infection. So if you attempt to decolonize patients just prior to surgery, this will reduce the risk of infection. Your nostrils are checked for the presence of Staph aureus. The optimal method of decolonization isn't really clear, but one thing I can tell you, or a few things, are that shower with chlorhexidine daily at home for a minimum of 3 to 5 days prior to your surgery. I recommend cleaning the sheets and your pajamas after the first shower and the evening before your surgery. You should use clean towels and clean clothing after each shower. An antiseptic should be applied to your nares, depending upon if you're colonized or detected colonization of Staph aureus, and really depending upon the institution. You may receive something for your nares during your chlorhexidine bathing at home, or you may receive something at the day of surgery. And chlorhexidine bathing is also done usually at the facility on the day of surgery. So here's your 10-point checklist for prosthetic infection prevention tips. Diabetes must be under very good control before and after surgery. Meet with your clinician to optimize diabetic control. Some of the guidance indicates having a blood sugar under 200, but I would feel better if your blood sugar was under 160. Ensure good dentition before and after your prosthetic placement. This includes going to the dentist and getting any dental work performed before your surgery. Quit smoking at least 4 to 6 weeks prior to your surgery. Nicotine limits your blood flow and causes vasoconstriction or limiting of your blood flow. And studies have shown smoking increases your risk of having heart, lung, and other wound healing issues after surgery. Lose weight if you're obese. Avoid using a razor or shaving near the incision site. Shaving causes little cuts in your skin that can be an entry point for bacteria. Be sure that you have no active infection. This includes a skin infection. And inform your surgeon if you have any skin changes. If you have an active infection, your surgery should be postponed. Item number 7. Reduce the skin bacteria by decolonization, like we talked about. Shower with chlorhexidine or use chlorhexidine wipes if you're unable to shower. And use the antiseptic in the nostrils. Number 8. Consider temporarily holding immunosuppressants. Ask your clinician if any immunosuppressant medications can be held. Number 9. Follow wound care instructions. One of the most important parts of these are washing your hands with soap and water well, or using an alcohol-based hand rub prior to even touching your wound. And of course afterwards. Number 10, avoid any other infections, especially any skin or bloodstream infections. Wash any new skin abrasions or cuts immediately with soap and water. And remember to have optimal dental hygiene with brushing your teeth every day and optimal diabetic control. Other items you can control that cause increased problems associated with surgery include too many narcotics, leaving your urinary catheter in too long. Ideally, this should be removed immediately after surgery. Not taking enough deep breaths. This increases your risk of getting pneumonia. Not following instructions, especially in regards to wound care, can result in infection. Not enough mobility or ambulation. Be sure to participate in physical therapy. Moving around helps to avoid blood clots and also speeds up your GI tract and helps with urination, decreases pneumonia. And you know, the hospital and surgeon should be following best practices. Here are some selected references. And as always, this is for educational purposes. You should consult your healthcare provider for guidance specific to your case. Remember your IQ. Stay informed. Ongoing videos on this channel will give you additional information about educational topics regarding infectious diseases. Ask questions. Why am I getting this? Are there any other options? What is the risk? What is the benefit? Thank you.